Welcome back to Toledo Clinic TV, where our guest is Dr. Christopher Perry. He is an ear, nose, and throat specialist. And you're here today to talk about really a revolutionary procedure for patients who have chronic sinusitis. First of all, tell us what the old procedure was like.
Sure. Well, thank you for having me come on and speak to you today. As you mentioned, I'm an ear, nose, and throat specialist, and I'm also board certified in facial plastic surgery. So the focus of my practice is allergy and nasal and sinus problems that many patients in our area suffer from. So years and years ago, the traditional and really the only technique for patients who failed medical therapy, patients with sinus problems and sinus infections and sinus headaches and nasal congestion and loss of smell and drainage was traditional endoscopic sinus surgery, which still is used today in select cases, but that involved using a rigid endoscope and rigid instruments to look inside the nose and to physically remove diseased tissue from the inside of the nose and inside of the sinuses. And while there's still a place today for that technique for some patients, some of the problems with that procedure is that it was painful. It led to postoperative scarring. It often required very painful nasal packing, and so for many patients it just wasn't very popular, and it fell out of favor. So
the new procedure uses a balloon?
The new procedure, called Balloon Sinuplasty, it's not really new anymore. It's been out for over a decade now. There's been millions of patients that have undergone the procedure, and I've been fortunate to perform thousands of these procedures in the Toledo area over the last 10 to 12 years, help a lot of people out who've suffered for a long time with chronic sinusitis with some of these symptoms that we talked about, the nasal congestion and sinus pressure and drainage and recurrent sinus infections and headaches. And so Balloon Sinuplasty, it's different because we use a scope to look inside the nose to place a flexible balloon through the nose into and through the sinus drainage pathways, and then the balloon is inflated, much like angioplasty for the heart. So that small balloon is inflated, and what that does, it opens up the sinus drainage pathway, and it does it without having to physically remove any tissue. And what that does, it allows the sinuses to drain better. It allows the body to function the way the body was designed to function. And so the nice thing with balloon sinuplasty is that it's quick, it's easy. It often does not lead to any postoperative scarring or need for nasal packing, and so that just translates into patients can feel better faster.
Is it permanent once you've done it?
It's a permanent procedure that it's not designed to be done over and over again. In select cases, sometimes we do have to perform it again if people have really bad sinus problems, but by and large it's a one-time procedure. And now, over the last several years, we've brought that technology to the point where we can perform it in the office. So it's exciting that we can bring a patient right into the office and with just local and topical anesthesia while they're completely awake, perform the procedure virtually painlessly, just much like a patient who would go to the dentist to have a root canal or a tooth filled. While that's, nobody likes to do that, but certainly we've evolved to the point where you don't have to be put to sleep to have a tooth filled for a cavity. And so in select cases we can take patients, take them right over their lunch break, bring them in, have this procedure done, which takes about an hour. They leave, they can drive themselves home, they can resume normal activities within a very short period of time. So the technology has evolved tremendously, and so it's really a fun time to be an ear, nose, and throat specialist because I have a fun job. I get to help people to feel better, to breathe better, to smell better, to sleep better. So I'm thankful for this technology because it just allows me to do a better job and help a wider range of people.
Who would be a perfect candidate for this procedure?
Well, this procedure is often performed on children as well. The youngest age that I've performed balloon sinuplasty, I think, is age 3 for a young child that had chronic sinusitis, but the oldest age, I think, was about 93. So it's a procedure that can be used safely, effectively, quickly on a wide range of patients, really. We'd want to do a CAT scan first to see if they do have any evidence of an acute sinus infection or evidence of chronic sinusitis. And if they failed medical therapy, that's certainly we want to do everything we can for these patients first. But if they failed medical therapy, then this just gives me another tool in my toolbox to be able to really tailor the therapy, tailor the surgical procedures appropriately. So again, years ago we had this one-size-fits-all procedure, the traditional sinus surgery, which everybody got if they failed medical therapy. And nowadays we just find that there's some people who fail medical therapy, maybe their sinuses aren't as bad and they don't need that aggressive procedure. So it's just nice to have an extra tool in the toolbox to help people out.
It's a better option for them.
Yeah, absolutely.
Yeah. Okay.
So,
Thank you, Dr. Christopher Perry. Thank you so much.
you're welcome.
And we'll be right back.